Hey everyone, how you doing? It's Mike Terry with Health Markets. Hope you had a great summer. Hope you enjoyed some of the great weather. It's now fall, which means it's that much closer to open. So we've spent the last couple of weeks learning about all the carrier changes, learning about all the industry changes, and so I wanted to take the next 10 minutes or so and bring you up to speed as to what is happening in the industry and how that's going to impact your plan. So if you are watching this video, you should be one of our Ohio customers, and this video is specifically to the Ohio changes. So let's jump right into it, and I will share my screen. But we are going to be talking about the 2024 changes for non-Medicare customers in the Ohio market. So before we jump into the content itself, I want to make sure that we are all on the same page as to what we do and how we operate at Health Markets. So you should by now know that we not only work with health insurance, but yes, we do life, we do disability, we do long-term care, we do dental and vision, we do Medicare. We work with all of it with over 200 different insurance companies. And since we work with all of those companies, we're able to help you no matter what stage of life you are in. And we are going to be able to make sure that you stay in the best plan from year to year. And most importantly, we are going to be able to give you that best price guarantee, which means that whether you work with us, whether you work with one of our competitors, whether you work directly with the carrier or directly through the marketplace, you will not be able to find it for a lower rate than what you were able to get with us at Health Markets. So this screen, I want to take a minute to spend some time on. This would be a perfect place for maybe some of you to pause the video and really look at how this graph could potentially impact you, because these are your options in the individual market. Now, we work with all of these options, so we can help you whether you want a major medical plan, a short-term plan, a fixed indemnity, or a health share. So if you are on a marketplace / Obamacare / Affordable Care Act plan, you are in that first column. In recent years, we have done a lot of enrollments in short-term plans, and we're going to talk about how those are going to be impacted for the new year. But the fixed indemnity and the share plans continue to stay an option out there. But again, they're going to be going through some changes this year. So we want to make sure that we touch on not only the positives, but the negatives of all of the changes for all of the plan types out there. But this is an important way for you to see, hey, do I want maternity? What plans will cover it? Do I have pre-existing conditions? What plans will cover it? Am I eligible for government subsidies? What plans will cover it? So this is a great way to get a snapshot of all of the plan options in a quick and easy glance. But let's drill down specifically into how the industry is changing in Ohio this year. So first, we're going to talk about the marketplace. So the positive of all marketplace plans, they do cover maternity. They do cover preventative care. They do cover pre-existing conditions. And if your income is at a level where you qualify for government subsidies, these will be your cheapest plan option. If you don't qualify for government subsidies, these are going to be your most expensive plan option because of the fact that they are covering maternity, preventative care, and pre-existing conditions. So what's happening this year? Okay. So the changes are going to be, we still only have HMOs available in Ohio, but there are going to be 2 new carriers coming to the market in Central Ohio. You're going to have United Healthcare, who is going to be a Mount Carmel only option. So if you are a Mount Carmel customer and you want to look at United Healthcare, they are going to be entering into the market in Franklin County. Also, we are going to have Aetna, and Aetna will have the Ohio Health Network. Now, here's what I'll say. We don't know where these 2 products will be priced yet, but I am always hesitant to put someone on a plan the first year that they enter into the market. We don't know how their customer service will be. We don't know how they will pay claims. We don't know what the rate increases will be for next year, and we'd hate to put you on a plan just in 1 year from now and have to pull you off. So unless the pricing is just so compelling that we have to do so, look for us to probably stand on the sidelines with these new carriers for this year, just because we want to make sure that they're going to stick around, that they're going to be customer friendly, and that you're not going to be in a situation where you're going to be really hating the fact that you made a switch. The other thing that we are seeing is that pretty much every carrier out there has said that they are going to have between a 6 to 9% rate increase across the state. Okay. Now, that doesn't mean that you are going to get a 6 to 9% rate increase. because Franklin County might get a 15% rate increase, while Cuyahoga County might get a 1% rate increase, and they average out, to be between that 6 to 9%. But you should be getting your rate increase letter from the carrier sometime in the next week. Here's what I will say about that rate increase. Couple things. One, if it's single digits, be happy. I know that's a terrible, terrible thing to say, but unfortunately, when it comes to medical inflation, single digits are good numbers, okay? So if you are getting those double-digit rate increases, we probably want to shop it around. Two, don't worry about your rate increase if you're getting a government subsidy for one reason. The rate increase letters that went out are showing the 2023 subsidy, not the 2024 subsidy. So the rate increase you're getting doesn't actually reflect the new subsidy amount, and it won't reflect the new subsidy amount until November 1. Because all the plans are going up in cost, we anticipate that therefore the subsidies will also go up. So despite you getting a rate increase, if the subsidy offsets that, you won't be paying that higher dollar amount. So yes, if you get a rate increase and it's double digits and you're not getting a government subsidy, definitely get with us. We will shop it around and find you a new plan. But all of the carriers still continue to be married to one health insurance provider. So you're going to have the Mount Carmel plans, and those are going to be your cheapest option. Then you're going to have the Ohio Health plans, and those are going to be your mid-priced options. And for those of you who see people within OSU or Children's Hospital, anticipate that those are going to be the higher priced options. Now, why? Because those hospitals charge more. And since the hospitals charge more, the insurance companies have to charge more. And so those of you who want Children's Hospital, those of you who want OSU, you will continue to pay a higher dollar amount. Next are going to be the short-term plans. And a huge change here with the short-term plans. The government has made it to where short-term plans for 2024 will only be able to be 3-month options. So what this means is if you have a short-term plan for January, February, March, you will have to get a new short-term plan for April, May, June, and another one for July, August, and September, and yet another one for October, November, December. 4 different plans, 4 different deductibles, 4 different sets of underwriting. So quite honestly, short-term plans do not appear to be a viable option for 2024. We're hoping that maybe there will be a new administration coming in 2025, and maybe they will revert back to the old laws. But for now, if you are a short-term customer, we have reached out to you. We want to get you renewed before January 1, before this law changes, so that you are not impacted by this change in legislation. So please, please, please be aware as to how those short-term plans are going to impact you. Ultimately, you see on the screen what a short-term plan covers, but knowing that they are going to 3 months is going to be a huge industry change for the new year. That then leaves us with the share plans, the faith-based options. Now, these likely will become more popular in future years if the short-term plan rule does not change back. But the share plans out there, they do have PPO options. They do give you coverage for maternity if you're married. They do not give you coverage for pre-existing conditions. They do not give you coverage for preventative care. The big thing with the share plan is it's not insurance. And so it is completely up to the group to decide what they want to pay, what they don't want to pay, when they want to pay, how they want to pay, or plain and simply, if they want to pay. So the faith-based designation, they make you live their faith-based lifestyle, certainly some limitations there. So ultimately, we will 100% meet with everyone face-to-face, over the phone, over Zoom, if you are unhappy with your plan. If you have had any changes, if you have moved, if there's anything of significance that we need to get updated, we will absolutely find time for you during open enrollment. But what that means is if you have not moved, if you have not had a change of health, if you have not had a change of income, if you are happy with your plan, please let us know. It is imperative that we get in touch with every single consumer and put our happy customers in one bucket and our unhappy customers in another bucket. If you're happy, if you want to renew, if you don't want to make any changes, we want to check you off our list and make sure that you are good to go for open enrollment. If you are unhappy in any way, If you want to see if there's a better option out there for you, please let us know that, and we will get an appointment time set up for you. So the phone number is on the screen. Brenda is doing our scheduling for this year, so you will speak with her. She will get you on the calendar. You will then have an appointment with me. And so again, the best ways to reach us through the phone, through email, through our website. Please reach out to us and respond as quickly as possible, because we will keep reaching out to you until you tell us, hey, Mike, I am happy. I want to renew. No changes are necessary. Or, hey, Mike, we do want to have a policy review and look at a new plan for the year. So that is the content for today. Hope all of you found it informative. One last plug, if you know of anyone else who could use our products and services, please, please, please refer them along. During this time of year is when we make our biggest impacts. And if there's anyone that you know that could use our products and services, we would greatly appreciate you sending that information along. So hope you all have a great holiday season. Hope you have a great 2024. Thank you for allowing us to continue to help you, and have a great day.